Hi everyone, we're here with our patient and my good friend David, and we're planning to do an open septorhinoplasty for him.
I've had breathing issues since I was a kid. I've always primarily breathed through my mouth. Something I've always kind of had an interest in correcting is my deviated septum. And then after seeing his work, I knew that he was going to be the right surgeon for me.
While we address his airway and improve his breathing, we're also going to look at a couple cosmetic issues with his nose, one being his dorsal excess or the hump along the side of the nose. And we're also going to support and stabilize his nasal tip. So David, a couple things we saw inside your nose is that you have a severe septal deviation. So your septal cartilage blocks off the right part of your airway and your bone of your septum blocks off the left part of your airway. A couple other things is that you have narrow internal nasal valves, which are on both sides of your nose right there. We're gonna open those up by putting some cartilage grafts from your septum to stabilize it and keep it open. Last, you have large turbinates, which are tiny little bones on the inside of your nose that have swellings of tissue. We're gonna shrink those down and reduce those to give you a more open airway. Next, we're going to address some cosmetic issues with your nose. So just this dorsal hump right here, which is your nasal bones up top and your dorsal cartilage. We're going to reduce that to give you a nice straight nose, but maintain your ethnic profile.
When I decided to get surgery, deciding on the septoplasty for the breathing improvement was my #1 concern. And then the aesthetic concern of the rhinoplasty was something I've always wanted to change as well. I had previously had that dorsal hump, and I'm happy to see that my new profile, as well as straight on, is honestly exactly what I always wanted, and the experience overall went very smooth. I'm very happy they chose Dr. Sharma and very thankful for the work that he did. So thank you so much, Dr. Sharma.
We're here with David. He's about 4.5 months out from his septorhinoplasty. What was your recovery process like?
It was pretty smooth. First couple days, obviously you got some painkillers you're taking, but really honestly not that bad. And then once the cast was off and everything, being able to just breathe consistently with my mouth closed has been huge. So thank you very much. Yeah.
Of course, it's our pleasure. It's great to hear that. So at 4 months, you still have a little bit more swelling to go. Rhinoplasty recovery is about 1 year long, but we've made some great improvements so far. So we're excited to see you the rest of the way through.